My name is David Lesher. I'm the Government Affairs Director at PPIC, the Public Policy Institute of California. And I'm sure most or all of you are aware of PPIC, but we are a nonpartisan research institute based in San Francisco with offices here in Sacramento in the Senator Building where I work with Amy Eubank, who you met on the way in, who's my associate here in Sacramento. We do research on most of the issues that cross the plate here in Sacramento, and obviously on social services and poverty, which we'll talk about today. There is a copy of the report on your chair and a couple other things on your chair too. There's a small sheet that's an evaluation form, and if you wanted to fill it out at the end and tell us how you think we did and drop it off in a little basket on the table on your way out, it would be much appreciated. Also, the slides that you'll see today will be on our website, ppic.org, after this event, as well as obviously the report. And there's not a video yet, is there? There will be a video that goes with it. And then this is being taped for broadcast, so if you want to avoid an embarrassing moment, you might silence your cell phone. One announcement, I wanted to say a thank you to the James Irvine Foundation. This is part of a briefing series that we do throughout the year on a number of different topics. It's called the James Irvine Foundation Briefing Series. So thank you to the Irvine Foundation, and a thank you to the Walter S. Johnson Foundation for their support of this particular work that we'll hear about today. As far as our upcoming events, one quick announcement. On October 24th at the Sheraton Hotel here in Sacramento, we are hosting an event about initiative reform. We have a report that will be coming out looking at the initiative process and some of the possibilities for changing it or improving it. And the report is done by Mark Baldessari, the president of PPIC, and the director of the PPIC statewide survey. So the report looks especially at public attitudes about the initiative process and public attitudes about what we might do to change it or fix it. There will be a panel discussion that goes at that event, and the panel will include former Assembly Speaker Willie Brown, former Governor Gray Davis, and former Chief Justice Ron Brown. So legislative, executive, and judicial branches of government. So with that, I will introduce our speaker today. Caroline Danielson is a research fellow at PPIC. She's done a lot of work in the area of social services and foster care and CalWorks and caseload trends for several years at PPIC. She got her PhD in political science from University of Michigan, and she's going to talk to us today about the California poverty measure. So please welcome Caroline Danielson.
Thanks, and thanks for coming today. Let me start by saying that the research that I'm presenting here and the publications that are available on our websites represent a collaborative effort between PPIC and the Stanford Center on Poverty and Inequality. And all but one of my co-authors are here today. They are Beth Mattingly from Stanford, Sarah Bone and Matt Levin from PPIC. And there's also Chris Weimer, who wasn't able to be here today from Stanford. What we measure matters, and nowhere is this as true in policymaking circles as it is in the realm of poverty, where the official poverty measure was developed as part of the war on poverty in the 1960s. In its time, it was a notable achievement, but over time, the official poverty measure has drifted away from being a realistic assessment of what it takes to make ends meet across the nation, but very, very specifically in California. And this is because it hasn't been modified to reflect some changes in how people, the sorts of things people buy, and in the safety net programs that help them to make ends meet. So there's been a national movement for several decades to design alternative poverty measures in the United States, and this movement produced an alternative measure produced by the census in 2011, and our California poverty measure is part of this effort. Now, let me be clear that the official poverty measure is not going away. It will still be used and is being used to track trends in poverty and to determine eligibility for safety net programs. But we created our California poverty measure to provide a more accurate and comprehensive picture of economic need in the state. So among the things that we do differently with the California poverty measure as compared to official poverty statistics is that we include what are now the largest needs-based safety net programs, CalFresh or food stamps, and the earned income tax credit. And we include these in families' resources. We also take account of out-of-pocket medical and work expenses including commuting and childcare expenses that families pay. And we factor in cost of living differences across the state, and here housing costs loom very large. So what do we find? To calculate whether a family is in poverty, we first add up their own earnings, safety net resources which they may make use of, and here we're actually taking into account what families are making use of, the earnings that they actually report and the safety net programs that they actually make use of, and also other income, which could include things like child support or unemployment insurance payments. And then we subtract medical expenses and commuting and childcare expenses, and these are out-of-pocket expenses. So if you're insured, you wouldn't pay the part that's paid by your insurance company, but if you had an out-of-pocket medical expense, that would be counted against your resources. And then once we've got this picture of net resources for every family, we then compare it to the poverty threshold. And this poverty threshold varies by how many members there are in the family, but also by whether, where you live, what county you live in the state, and whether you rent, own your home with a mortgage, or own it free and clear. And if, very simply speaking, if your resources are above the poverty threshold, then you're not in poverty. If they're below the threshold, then you are in poverty. Poverty thresholds for most Californians range between about $29,500 for a family of 4 and $37,400, again, for a family of 4. For a few in the low-cost areas of the state, the poverty threshold could be as low as $19,500, and this is all for 2011. Once we make this calculation, we find that 8.1 million Californians lived in poverty in 2011, according to the California poverty measure, and this is about 22% of the population. Among those 8.1 million, 2.2 million lived in deep poverty, or in other words, they had resources that were less than half of what it takes to make ends meet in a very basic way. This is roughly speaking, on average, for a family of 4, about $16,000. Puts you in deep poverty. So about 2.2 million Californians lived in deep poverty. Breaking these numbers down further and comparing them to official poverty statistics, we see that more Californians are in poverty according to the California poverty measure than according to the official measure, and this is about 2.2 million more Californians are in poverty once we measure poverty in a more realistic way. For children, poverty is the highest, and for the elderly, poverty is the lowest. However, the picture is much different for older adults and for working age adults, whereas for children, the resources that we take into account and the higher thresholds more or less offset each other. So poverty is a couple of percentage points higher for children, but for working age adults and for older adults, poverty is much, much higher. And so throughout the rest of this presentation, I'll focus on both. I'll take a look, I'll show you both overall results for all Californians, but I'll show you also some results by age groups because poverty does look different, and the safety net in particular assists children very substantially, and medical expenses play a large role for older adults. Looking at deep poverty, the good news is that we actually overall find fewer Californians in deep poverty according to the California poverty measure. 6.1% of Californians are in deep poverty, according to the California poverty measure, and the difference is especially large for children, where 5.7% of children are in deep poverty under the California poverty measure as compared to nearly 10% for official poverty statistics. The exception here is older adults, who are actually, there are more older adults in deep poverty under the California poverty measure than under official poverty statistics. Let me turn now to giving you a more specific assessment of the role of the social safety net, of needs-based programs in helping families to make ends meet. And again, we're really showing you here how families are actually using the safety net in California in the snapshot from 2011 that we have. not some ideal sense of how they might use it or we might want them to use it, but how they're actually making use of it in California. Here, this table shows you the list of the major social safety net programs, the needs-based programs that we're including in the California poverty measure. And the first 3 rows of the table show you the cash-based programs: CalWorks, welfare assistance for families with children, general assistance for single adults, and supplemental security income for the blind, disabled, and elderly. All 3 of these cash-based programs are included in official poverty statistics. The next group of programs are not. They're excluded from the measure, but we include them in our California poverty measure. So they are CalFresh, or food stamps, federal tax credits that include the child tax credit and the earned income tax credit, housing subsidies, and finally school meals, school breakfast and school lunch. So this table makes clear that millions of Californians benefit from these programs and that we spend billions of dollars on them. But what we don't learn from this table is how families are piecing together these resources to help them make ends meet. And we don't get a broader picture of how these programs move the poverty line for families. Now let me be clear that the goal of alleviating need is only one of the goals of all of these major programs. They all have other goals. CalFresh clearly has the goal of improving nutrition and alleviating hunger. For example, the Earned Income Tax Credit and CalWorks have the goal of encouraging employment. So they all have multiple goals. One goal is to alleviate need. And here, the California poverty measure helps us to set these programs into larger context of how they're helping families stay out of poverty. So first, taking a look at CalWorks. These green bars are showing you the California poverty rate for all people, for children and for the elderly. I don't show working age adults because their rates look very similar to the overall rates. If we remove the resources from CalWorks, the poverty rate is about 1.3 percentage points higher for Californians, and most of this is due to, quite a lot of this is due to an increase for children of 2.5 percentage points, which is equivalent to nearly 250,000 children. Turning to CalFresh, it plays a larger role, about 2.1 percentage points for all Californians, for children particularly, and 4.1 percentage points, which is equivalent to nearly 500,000 children not in poverty because of the resources from CalFresh. Finally, the federal tax credit programs play the largest role in here for children. This is over 500,000 children, or 6 percentage points. Over 500,000 children not in poverty because of the resources that families made use of in 2011 from the EITC and the CTC. I'm not going to show you housing subsidies and school meals separately and SSI separately, but in this next slide, what we do is we combine all of the resources from the programs, including CalWorks, CalFresh, EITC, but also the other programs that I'm not showing you separately, to say, what if families didn't make use of any of these resources? What would poverty look like? And we see a very substantial effect. For all Californians, instead of 22%, poverty would have looked like more like 30%, and for children, poverty would have been closer to 40%. So taken as a whole, poverty in the absence of the social safety net would have been much higher. Looking again at deep poverty, it's very notable that the deep poverty rate would have been more than twice as high in the absence of these programs, and for children, deep poverty would have been more than 3 times as high. So a very substantial effect of the social safety net on children and indeed on Californians. At the same time, I've already told you that we find more Californians in poverty despite the major role that the social safety net seems to play for Californians. Why is this the case? Well, as I've alluded to, the cost of living in California is higher than the official poverty measure would lead us to think, and that's part of what's driving the differences. So let me talk about this a little bit more in detail. Most Californians live in high-cost areas of the state, so 69% of the population live in areas of the state where the average poverty threshold for a family of 4 is $31,300. And this is nearly $10,000 more than the official poverty threshold the bar against which families' resources are gauged in order to determine whether they're in poverty. And that poverty threshold for the official poverty measure is about $22,811 in 2011. So the poverty bar is just simply much higher for most of the state's population. And even in the lowest cost counties, where only 9% of the state's population lived, the average poverty threshold for a family of 4 under the CPM is higher, about $1,000 higher. So how does this matter in poverty rates? If we were to apply the official poverty thresholds for families in California, poverty would be simply a lot lower. So the difference that's due to adjusting the poverty thresholds is about 9.2 percentage points for all families. And if you recall back to that total safety net side, this is roughly similar to the impact of the entire social safety net, which was 8.4 percentage points. Similarly for children, 11.1 percentage point bump up due to the adjustment and cost of living in California. For older adults, the bump up is still substantial, but it's smaller, and this has to do with the fact that older adults are more likely to own their own homes outright. And poverty thresholds for those who don't have a mortgage and don't rent are somewhat lower, comparatively speaking. Turning now to expenses, when we factor in work-related expenses and medical expenses, poverty rates are between 1 and 7 percentage points lower if we don't factor them in, but once we factor them in, poverty rates rise, and this difference is the most substantial for older adults, where medical expenses bump up poverty by 7 percentage points. So we can see why, despite the role of the safety net, that more Californians are in poverty because of the factoring in of expenses and cost of living. So in sum, we find 8.1 Californians in poverty. This is more than the official poverty statistics would lead us to believe. At the same time, the social safety net substantially moderates poverty for children and the deep poverty rate, which is good news. But the safety net is offset by higher costs of living in the state and by non-discretionary expenses like medical out-of-pocket expenses and childcare. We developed a California poverty measure to help policymakers and the public to better understand, have a more accurate assessment of economic hardship across the state. And the publications, the research I've talked about today and the publications on our website help you to delve a little bit more into some of these differences. It also has the potential to be taken further. We can think about ways of delving further into regional differences in poverty, understanding the role that cost of living plays as opposed to the social safety net programs regionally. We can do this for demographic groups that might where we might compare families with young children as compared to families with no children, or families with lower versus higher education, and look at the role of the social safety net. And some of this we've started to do in the publications that you can already access, but there's potential to do a lot more. There is also a potential to start to think about how, if we alter programs, will we not only aid fewer or more Californians and spend less or more money, but how will we move the poverty line if we alter programs? And there's potential to use the California poverty measure in this research to move in that direction to help provide a broader assessment of how these programs, how the social safety net works for Californians. Thank you. And I am happy to take questions or comments. Yes?
I have a question about something that came out of the Brookings Institution recently, a study about poverty in suburbs. Mm-hmm. And I wonder if this study fractionates by county or by zip code or even by race. One of the problems that we're seeing is secondary suburbanization. And so that there's white flight, from this core, and then it goes back to the core again, like here in Midtown. And then we see some of the suburban, what used to be suburban areas impoverished. And I'm kind of wondering, is there any way that, say, Sacramento County or City of Sacramento or City of Elk Grove could use this data? Are your data sets malleable enough to, expand the report for local policymakers, for poverty issues?
Sure. So the underlying data source that we augment with many other sources of data to get the most accurate picture, but the underlying data source is a survey. It's the American Community Survey. For California, the sample size is over 350,000 respondents. This does allow for county level estimates for many counties, but not all. 38 counties are separately identified. For some of the largest counties, there's some potential to get below the county level, but I don't know whether that's the case for Sacramento. In any case, we would, to do that, we would very likely want to pool some years to get additional sample size, so it would be less a picture of trends over time than an average over several years to get a sense of that.
Can I just add to that?
Yeah, sure.
You mentioned the issue of suburban poverty, and one of the things we haven't yet done, but we could do, is chop up California by its major metros, suburban areas, and non-metro places, and look at how poverty rates vary, and by some demographic characteristics in that aggregate. So we couldn't do that within counties, but we could do that across California to see if some of the trends that Brookings is speaking to in that report, in that book, hold.
I was actually more concerned about the Blue Ribbon Commission that was established here in Sacramento County for the disparities in black infant or black child death rates. And so, and we need help on that. How do we get that data? But it sounds like we might not be able to get it down, to ratchet it down to county or zip code.
Not
Below
with
the
1
level
year
of the
data.
county for Sacramento, I don't think that's possible.
And looking at race differences within Sacramento, you
Or
start
even
to
just
get
the
good.
rates too, yeah, and rates, race.
Right, we do, in the Stanford report, look at racial differences across the state, but when you drill down to county to try to do it that refined, we'd need to combine multiple years of data.
Yeah, I just have this idea that if people or families could pool their resources, that would help them lift out of poverty. So I was wondering about correlations in household size.
We have not looked at this by household size. So I will say that the adjustment to the threshold is not a one-to-one. So every additional member that you add bumps up the threshold by the same amount. There is some taking into account the economies of scale of a family. So the threshold, in some sense, takes account for that. But it would be possible, certainly, to look at smaller versus larger families and to try to better understand their poverty. Certainly a potential.
Can you drill down for disability? 20% of the population has a disability. Is there a way to drill down for disability?
So the American Community Survey does ask some questions about disability, but they're not very detailed. And so the limitation would really be how accurately are we measuring true disability. So there's the potential to do that, but with the caveat that the level of detail about the questions might not be as satisfying as you might want it to be.
Oh.
But there's certainly that potential.
And Medi-Cal, healthcare is not part of the factors
So
here?
the way that Medi-Cal enters into the California poverty measure is by out-of-pocket medical expenses. So if you have insurance of any sort, but if you have Medi-Cal, then your out-of-pocket expenses are expected to be very low versus someone who's uninsured, for example.
Yeah, I've got two questions. One is looking at the poverty levels, how the percentage of how they've increased since the beginning of this recession, 2008, 2009, what that increases. And the other one is just an obvious one about cultural and ethnic backgrounds in terms of poverty disparities.
Sure. Let me speak to the first question, then maybe I'll turn over the second question to Beth because the Stanford publication talks a little bit more about racial and ethnic differences in poverty. So for the first question, we have, at this point in time, looked at 2011. So we don't have a comparison over time. I will say that some other states, including New York and also New York City, have done this, and Wisconsin have done this for over several years. And they tend to find that, social safety net programs grew during the recession, and they helped to moderate what would have otherwise been a larger increase in poverty. So at some point in time, we could also extend it backward, given the resources, but at this point in time, what we've looked at is 2011.
So one of the things in terms of disparities, one of the big disparities to show up when we do the CPM measure and compare it to official poverty estimates is the disadvantage that immigrants face, and their poverty rates rise by by over 11 percentage points. We do see that blacks fare better than other racial groups, and we're still exploring that, but thinking about things like where they're living, what their thresholds are, and also that they may be taking up the safety net at higher rates. So those are a couple of things to point to immediately with the disparities.
In the back?
I was just wondering if you, excuse me, if you could, if you had any update on what the federal government was doing with the existing poverty measure, if there's any, you talked about in the 90s, they were talking about updating it, but where we are with that.
Sure. So the Census Bureau has begun releasing what they call the Research Supplemental Poverty Measure, and they started doing that in 2011, and there'll be an update to that coming later this month or next month. So they take a similar approach as we do. They use a different data source. The current population survey, we use the American Community Survey because it's such a larger sample size. So for state level estimates, it makes a lot of sense. So yes, they've also begun releasing a similar sort of measure for the nation as a whole, and they do 3-year estimates for states.
Do you have confidence that this is accurately captures undomiciled families and people that your survey?
I'm sorry, could you repeat? I didn't catch all of it.
Homeless, does the survey capture undomiciled families and people?
Yes. So this is an important point. Neither the official poverty measure nor any of the alternative measures, including our California poverty measure, captures anyone who's not living in a housing unit, even if temporarily. So we exclude, these surveys are surveys of housing units and people within them. So if you don't have a home, then you're not surveyed. We also exclude those who are in group quarters, which could include a shelter. So it is, not representative of those without a home. And neither is the official poverty measure.
As a follow-up on the federal question, do you see any movement to changing the benchmark for the subsidy programs in terms of eligibility?
I think there are certainly discussions of that. I haven't seen, to my knowledge, there's been no major movement in that direction. To use simply say what we've implemented for this measure would probably not be entirely practical. So we tried to devise our measure to be as accurately reflective as we could of economic hardship in the state, but to make it a practical measure for use for program eligibility and to adjust it for cost of living regionally. You'd probably want to make some different kinds of adjustments. But no, I'm not aware of political discussions that have moved very far in that direction.
Caroline, does this, back to the homeless question, does this include, because in schools they measure homeless children, so is that number included in the study, or is that also separate? Because schools measure that differently than, the continuum typically does.
So the sort of the straightforward answer is if you're living in a home and you're not in a group home of any kind, so you're not in a dorm or in the military or in a shelter or a nursing home, then you are included. But if you are living in one of those group situations, or if you are simply homeless, then you are not included in the universe. So you're not included either as someone in poverty or someone as part of the population. So it's just, you're just out of the measure. So it is a limitation of both what we do and what census does.
Okay.
Hi, I'm curious if you have any information about the regions where it was, where people took more advantage of the resources available, how they found out about those resources, or what was going on in those areas that, you know, was the reason for the increase. And then I'm also just curious if you have any specific recommendations for local or state policymakers about what they should do with this information or how they can make more efficient use of the resources available.
Thanks. All of this research is based on a survey, and the census is very careful to protect confidentiality. So we know, broadly speaking, where someone lives, the county or maybe group of counties. When for smaller counties, they group them and they don't. You're not able to see whether you live in Sutter or Yuba. You can only see whether you live in one of those two places. So we don't know exactly why people are or not making use of the safety net in specific, because that would take more sort of qualitative research, perhaps. We can pinpoint in some way some trends across maybe different parts of the state or some differences between urban and rural, and then start to think more, to speculate maybe, but to think more about like what might be behind those and then take action based on that. But it wouldn't be specifically because of knowledge that we got from the survey, because that's not possible. So as far as your second question goes, we designed the California poverty measure to be a more realistic sense of what it takes to make ends meet. So I think it gives policymakers a better sense of where those safety net dollars are going to what kinds of families. I think there's potential for us to then take it in different directions to try to assess where the differences are cropping up and whether there might be potential to restore some equity if that seems to be the case.
Yes, I'd like to follow up on the question that the gentleman asked earlier about the inclusion of Medi-Cal in the resources. It seems like excluding that, does not recognize that the people on Medi-Cal have a benefit that's worth, a few $1,000s a year potentially, at least for children, and more for, high health needs folks. Can you comment on that a bit more? You mentioned that you feel like it's sort of, I guess, implicitly included because people on Medi-Cal will have lower out-of-pocket health costs. But for children, at least, most of them would not have out-of-pocket health costs anyway, because thankfully most kids are healthy. It seems like that would treat an uninsured child the same, who has no health costs, the same as a child on Medi-Cal. But that doesn't seem to capture the fact that the child on Medi-Cal still has, an additional couple $1,000s in a service that, that is to their benefit, certainly.
Sure. So that's correct. The way we incorporate out-of-pocket medical expenses is by subtracting them from family resources. So if you have insurance of one kind or another, then likely your expenses or out-of-pocket expenses are going to be lower, and in particularly for a child on Medi-Cal. But it does, what this procedure does is to take it into account actual expenditures. So for example, if someone's uninsured and they have unmet health need, then the California poverty measure doesn't take account of that. If they haven't used services because they're uninsured and they don't want to pay for them, but therefore their health is worse, then we are not taking into account of that, taking into account those kinds of unmet needs. But if someone spends from their own pocket thousands of dollars to pay for some medical service that they need, as compared to a child who's enrolled in Medi-Cal and they pay nothing or nearly nothing for the same service, then that would go into the expenses piece, which, as we saw, can range ranges between 4 and 7 percentage points of the poverty line, of the overall poverty rate, even for children. So it's not a small amount, but it is an amalgam of the different kinds of insurance and uninsurance, that was reflective of the population. It's not specifically about Medi-Cal.
Okay, I'm just connecting the dots to something that would be implications for policy that is not covered here, but this is where we're probably going in California, is looking at the large employers, and I'm just using Walmart as an example. I mean, there's other retail, hospitality, there are other huge employers who are employing people at less than 30 hours a week or whatever it is,
Just because the minimum wage is going to be going up, it's still going to be giving some people, allowing some people to still stay at the poverty range. So looking at just the work environment of people who are working, who are still in poverty, and also taking advantage of some of these policies that taxpayers are paying for. I'm not sure how else to phrase that right now, but just the implications for work that is still keeping people at poverty level.
So definitely we take into account family earnings as part of family resources, and to the extent that the minimum wage goes up and someone is in a minimum wage job, then their earnings will be higher as a result if they remain in that minimum wage job. Also, as the economy is improving, we expect, as compared to 2011, in the current, very present moment, we'd expect the family economic situation to be a bit better, simply because more people have jobs and perhaps they're earning a little bit more, they have more hours, or maybe their wage is a little higher. So from that point of view, we are incorporating that, but we really are trying to paint a picture of what's sort of actually the case in California. And so it does reflect the actual wages that are in fact paid by both large and small employers.
Okay.
I don't know if that helps.
I'll leave it at that. It's just something that's on the table that a lot of people are looking at, is our employers and what they're paying and how many hours. And we're still, I don't want to say subsidizing because that sounds derogatory, we're still supporting a lot of people who are trying to work and yet still are not making a decent salary for their families and their incomes and living wage.
It is certainly the case that most families living in poverty, as we calculate it, do have some earnings. It's about at least 3/4, if not closer to 80%, in 2011 had at least some earnings in the past year. So even though they were also quite often making use of social safety net programs, they were combining it with earnings. Linda.
Yes, just a quick question. I know you mentioned that New York and maybe Wisconsin, I believe, had done similar surveys, and understanding that, we have higher housing costs might kind of distort it, but what kind of parallels and differences did you see between the states, if you had a chance to look at that?
A similar sort of picture, in the sense that the social safety net really does moderate poverty quite substantially. I think compared to the nation as a whole, when you look at the Census Bureau supplemental poverty measure, we have, roughly similar effects of some of the big programs, CalFresh and the ITC, but a little bit lower. CalWorks, the role of CalWorks in California is simply larger than it is in most states. I think New York is probably an exception here, because we have both more families on CalWorks relative to other states, and we tend to pay a somewhat higher benefit. So it makes a bigger difference for poverty. This is despite the fact that we did cut the program and that the program's been declining since 2011. And has never reached the height that it saw in the mid-1990s in terms of serving poor children. It's nevertheless the case that, relatively speaking, CalWorks is a larger program than the TANF programs in other states. So I think roughly comparable. One thing that we do in the California poverty measure is we take some great effort to try to correct for some underreporting of program income that people tend to do, is pretty well known on surveys. And so that's something that we try to take careful pains for in order to more accurately reflect the role that the social safety net plays.
Caroline, Mike Carroll with Western Center. Did I miss it, or does the data in here include the impact both positively and negatively of childcare costs?
Again, childcare is an expense that we calculate, that we subtract from family incomes, and it's an out-of-pocket expense. So if a family has a childcare subsidy or has a relative caring for their child, or children are in school, public school, then that wouldn't be reflected as an out-of-pocket expense, but we do calculate out-of-pocket expenses for childcare, and that's subtracted from resources in order to get a net income, or a net resources.
So could you tell us, for example, what percentage of people end up within the poverty definition due to the resource, the cost that they have to pay for their childcare?
Yeah, so the difference for commuting and childcare expenses, so combined, it's between 1 and 3 percentage points. So for children and adults, it's 2 to 3 percentage points bump up in the poverty rate due to both of those things combined. But if we were to take out commuting expenses, Matt, is about half or a little bit less. So most people are working, and therefore
Right.
most people have commuting expenses. But childcare expenses depends on whether you have a young child versus a child in school, whether you have someone at home to take care of that
Correct.
child versus,
Correct.
so childcare expenses tends to affect a smaller proportion of the population, but when they have that expense, it's larger than a commuting expenses. So together, I know that they bump up the poverty rate by 2 to 3 percentage points. I can get back to you about the relative role of childcare versus commuting expenses in that picture.
And of the policy, is there a recommendation, or will you be doing further research on what would bring down the poverty rate? Obviously more money, but I think more like from a programmatic standpoint, would a state EITC or a state child tax credit, what would have the biggest impact in terms of, for policymakers if they were to choose to pursue one?
Yeah, so that requires developing some scenarios of how programs might change, and that's something that is for future research. And honestly, there's many potential scenarios. So you could think about a state EITC. You could think of restoration of cuts to CalWorks. You could think about topping up school meals. You could think about a number of ways of doing this. And some of those are more straightforward or less straightforward to model, but certainly you could take a look at that. And then one way of assessing what the impact of those changes would be to say, how does it move the poverty line? It's probably not the only way you'd want to assess that, of course, but that would be one way of doing that. So yes, there's the potential to do that. Probably in maybe as not quite as a fine-grained way as someone might like to see, whether, say, Sacramento City Center, what would happen if we had a state EITC. That's definitely beyond what the data could allow us to say, but we could make some broad conclusions and hopefully help inform decision-making around changes to the safety net in future years.
So this is the follow-up to the question about Walmart and the 30 hours a week and less. So are you looking at the trend of not only Walmart's, but even the state of California and other large public employers to the so-called pension reform, which has slashed pension benefits for new hires, and the trend to cut pensions and health care and other benefits that public and private employees used to enjoy, and how that is going to contribute to more poverty down the road?
Sure. So if we were, to be clear, if we were to try to model that, it would be using a current year, or in our case right now, 2011. So the world will change between now and, say, 20 years from now or 10 years from now in the sense of, like, what would the threshold be? How will consumption patterns change, and how will that modify? So it would be all else equal, but let's assume something different about pensions. We could think about modeling that. In fact, we include, as the official poverty measure includes, Social Security. So it would, you could talk about what if Social Security were, not that that's really on the table right now. You could certainly do that. We include retirement income as one of a source of income. How realistic that would be in the larger picture is a whole separate question. But sure, we could pull it apart and think about, create some what if scenarios, potentially.
Hey, you mentioned the high cost of housing, a couple points in the report, and I was just wondering if I'd appreciate any additional observations you had on housing.
Sure. So we do factor in federal housing subsidies into family resources, and that does reduce poverty by about 1.5 percentage points in the state, and the effect is actually larger for older adults than it is for working age adults and for children. At the same time, we take housing costs as sort of given when we compare family resources to poverty thresholds. We look at what actually families report they're paying for a particular kind of housing within a county, and then take that as just the cost that they face and incorporate that into the threshold that is the bar that they need to rise above. So in some sense, we take that as a given. Could there be policies that would reduce housing costs or increase them? Yes. In fact, California, arguably has several of those kinds of policies. So that would then be reflected in future years if it actually changed housing costs. And certainly, there's the potential to have discussions around that. We can specifically say, at least from our estimates, how much is housing by type, by rental versus mortgaged versus owned outright. By county, we have that calculation.
My question is, did you look at the interaction between programs on like each other? For example, CalWorks provides work supports.
Yep.
And then when a woman can work, she also gets earnings and she can get earned income tax credit.
Yeah.
So were these effects just independent of that interaction, or do they include that interaction?
So they are, right, so they're calculated based on our best sense of what the benefit would be for CalWorks and what the earned income tax credit would be for someone with earnings. So if they report having earnings, then that would lower their CalWorks benefit and would raise their EITC benefit relative to someone with no earnings. So yes, we do do our best to take into account the interaction across those things. When I showed the total social safety net slide, that's also another way of taking into account interactions, because some people could be raised above poverty by any one of a number of programs that they participate in, but others need the combination in order to rise above poverty. So if you were to count those programs separately and then add them up and say, well, this is the difference to poverty, you'd get a somewhat too large estimate. So we do take account of interactions in that way as well when we're talking about how Californians are moved above the poverty line by social safety net programs. So in both those senses, we do our best to take account of interactions.
Thank you. Hello. I wanted to ask first if you have had any discussions with our policymakers, that is our elected officials. Are they interested in addressing some of these issues? And could local and state government departments be doing a better job of maximizing the benefits of the subsidies, such as housing, which is really, as he says, 1% people benefit. So are any policymakers interested in the state of affairs and improving conditions through maybe perhaps improving performance?
Thanks. Certainly, as we were developing this research, we spoke to a broad range of stakeholders, including legislators and their staff. And I think our report was officially released today. And so I think we're very interested in doing additional outreach to find out how this measure could be made more useful to policymakers at the state level for sure. I think to some extent there's some potential at more local levels to make use of it, but as I think the early comment about Sacramento City made clear, there's some limitations in how finally we can delve into. We might be able to talk about metro areas across the state, but not maybe Sacramento metro area specifically. Certainly, there's information that there's the potential for to provide counties with more information about how their social safety net is moderating poverty for children or for other sorts of families. I mean, we talk about age groups, but you could talk about different kinds of subgroups of families. There's potential for doing that and helping to inform outreach efforts. I mean, California is a county-administered state, so to the extent that counties are doing outreach to bring in eligible folks, there's some potential for that as well.
Hi. Yeah. Has there been any, I guess, empirical work or anything done on figuring out if there's a tie between businesses contracting and leaving the state or dying and poverty rates? So maybe if one comes before the other?
well, broadly speaking, it's certainly the case that when employment shrinks, poverty tends to rise. Apart from that, I'm not aware of any more specific research. We at PPSC, of course, done some work on business moving and death and creation in the state, but linking it specifically to poverty is not something that we've done.
So my apologies if I missed this in the while I was reading the report. But I see that you've broken it out by in terms of children as a percentage of the overall population and adults, breakdown between seniors and other adults.
Working it, yeah, sure.
But my question is, do we know what the overall number of families that represent the overall number of poverty within the greater denominator?
So I'm not quite sure I understand your question. So we calculate, so families share resources for sure.
Yeah, so I guess families versus single adults, perhaps. So children and their parents as a.
Sure. Say individuals within families versus individuals within single unit households, or maybe couples with no children. No, we haven't done that calculation, but it would be certainly possible to do. It's not in our report, but it was certainly something that we could do, and we could get back to you about that if you're interested.
You kind of answered my question, because I was going to kind of dovetail off that. There have been recent reports that college students are have higher poverty rates than the general population. And so I was going to ask you if your data showed that separation in the working age adults, if they were college attendees or not, and what their California poverty rate might be.
We haven't tried to do that for people who report they're in college. I will say, though, that there are a couple of groups of college students who are actually outside of our, so to speak, poverty universe. And they are, if you're living in a dorm, you don't get counted. And if you, there's a small group relative to the size of the college student population of about 44,000 students who appear, from their characteristics, they're between the ages of 18 and 21, they're living in a college town, they appear to be supported by their parents, but they have no source of their own income, so they're not reporting income because it very much seems that they're being supported by their parents. So we take them out because we don't want to, in towns that have large college populations, bias the poverty rate upwards by thinking that these students are extremely poor because they're really reporting very low income. But in reality, they're actually being supported by their parents. We can't know that directly from the survey because it's not asked that way. We can only know what they report about their own income. But from circumstantial evidence about their that they're enrolled in college and their age, we can infer. And so we take them out. It's only about 44,000 people. So there are some caveats around what we can say about college students. But as a larger group, we could start to talk about sort of students enrolled in higher education and what their poverty rates look like. Sure, certainly that's a potential. Well, I think we're around about at 1 o'clock, and I know some people need to go, but I'm happy to stay around for discussion. And I think Beth had a comment.
Yeah, I just wanted to let folks know, if you are interested in hearing more, at 11 a.m. tomorrow in Mendenhall Library on Stanford's campus, we're going to have another event to talk a little bit more detail about some of the demographic differences across the state and some of the poverty in the poverty rates and the safety net effects. I'll be there. Sarah Bone will join me. We will also have Ann O'Leary from Next Generation and Center for American Progress, and Trudy Renwick, who until this morning was chief of the Census's Poverty Measurement and Statistics branch, will also be joining us in her role as a private citizen tomorrow. Thanks.
Thanks for coming.